Good day to you all from wherever you are joining us. A very good afternoon from Nairobi, Kenya. I'm glad that you could join us today. My name is Vivian Atakos, and I am a communication specialist working for the CGIAR. Welcome to this 1CG session where we are going to discuss accelerating resilience and recovery through One Health. As you will see, it is a very quick but extremely rich session. Tunde, we go to the next slide, please. And you'll see that the format that we have prepared is to help us move through this conversation quickly, but ensure that you make the most of it. So we are going to go through 3 rapid fire presentations, and then we'll get into a question and answer session with the speakers, as you can see on the screen. Thereafter, we are going to engage online. But for now, for the audience that is joining us, please continue engaging with us on Twitter via the hashtag AGRF1Health, and also by following the handles at IFPRI, at ILRI, at CGIAR, among many others. So let me move us straight away to the rapid fire presentations. And as you can see, we have 3 speakers. We have Dr. Steve Stahl, who is Editor, Global Food Security. He's based in Malaysia and is also an Emeritus Fellow at the International Livestock Research Institute, ILRI. We also have Dr. Dina Najjar, who is a gender scientist at the International Center for Agricultural Research in Dryland Areas, ICARDA. And finally, we'll have a presentation from Dr. Aminou Aruna, who is the program leader and impact assessment economist with the Africa Rice Center. So let us move on to the rapid fire presentations. Tunde, to the next slide. And Steve, you have 2 minutes for this segment.
Hello. So I'm going to tell you a bit about a study that we just completed about wild meat value chains and zoonotic risks. This was based on a literature search of over 100 sources. The objective was to understand the practices, the actors, and the incentives driving what's sometimes called bushmeat, sometimes called wild meat, and what are the implications for zoonotic disease risk. We found out that 44% of forest margin households across Africa participate in some way in these wild meat value chains. They're hunting mainly ungulates like antelopes, primates like monkeys, rodents. But from a zoonotic risk perspective, bats, primates, and rodents are the species that are most risk to humans. Now, interesting, most hunting is not driven by market demand, although you hear a lot about bushmeat markets, but it's consumption needs in rural households. So the level of rural bushmeat consumption is very high. It plays a key role in availability of animal source foods. But interestingly, if cheap livestock meat is available, consumption of wild meat is less. The study showed that the level of understanding of the zoonotic risks among people, hunters, consumers is generally poor, and few people take any action to mitigate the risks of contracting zoonotic diseases when they're handling animals, when they're slaughtering animals, and so on. And the other thing that was interesting is that there are monitoring efforts in sort of bushmeat, wild meat trade, but they're focused on wildlife conservation and the consumption needs in rural households. And they generally ignore the zoonotic risks. And now in the time of COVID, zoonotic risks, of course, are of much greater attention. So the study identified the research needs are improving community zoonotic risk understanding, looking for livestock alternatives, community-based management strategies, and integrated monitoring methods, which include zoonotic risks and the other targets of conservation and consumption monitoring.
Great, thank you so much, Dr. Steve Stahl. You've highlighted your presentation very well. Let's move on now to Dr. Dina Najjar, gender scientist, and over to you, Dr. Dina.
Thank you. Thanks, Vivian. So I'll be talking about the gender impacts and coping strategies for COVID-19 pandemic in rural Egypt and Tunisia. I'll be just presenting the highlights of my research. This was conducted in March 2020. So we found that livestock is the most severely affected commodity in these rural areas. because the lockdowns coincided with the Adha holiday, where livestock sales were severely impacted, as well as access to veterinary services. And also because the local markets were also closed, women were severely affected, those especially who sold chicken, milk, and dairy products. And these women, they responded by diverting supplies for domestic consumption. In both countries, there was a disruption in feed supplies. And I want to highlight that in Tunisia, both men and women responded to these feed shortages by allowing their livestock to graze farther on rangelands and for extended periods. For crops, these commodities were less severely affected because of they're less perishable. So farmers were able to store them and wait until markets recover and prices improve. However, there was a reduction in hired labor. There was a reduced access to hired labor as well as herbicide. And this led to an increase in women's workload. And also some households were not able to plant vegetables. There was an increased dependence on digital services. So we looked at whether there are any gender gaps in cell phone ownership, and we found a very big one in Tunisia. And also we found that in both countries, men and women also preferred radio and television to receive information. Finally, for personal well-being, we found that women, even in the same household as men, were more likely to report increased domestic tension due to job losses, decrease in sales, as well as increases in household expenses, for example, for the detergents that were heavily used.
Thank you very much, Dr. Najjar, and for keeping time. Moving on, Dr. Aminu Aruna from Africa Rise. Take the floor.
Thank you. I'm going here to present regarding a number of activities, not only one, on which Africa Rise is working in order to increase the resilience and mitigate the impact of the pandemic in West Africa. So since last year, in all of our activity, we have integrated COVID module, which help us to collect data to know what are the level of impact and what are the resilience measures. In this area, we found that access to seed was a main constraint because farmers, because of the pandemic, they eat not only their production, but also their seed. So Africa Rice has developed a project in 5 countries in West Africa, which countries are Benin, Nigeria, Burkina Faso, Mali, and Cote d'Ivoire, in order to deliver 8,000 seed producers to be benefit. We are also target 2 million farmers and 10 million consumers. We did also the assess of a number of impact assessment where we see that people are really feeling the impact of the COVID-19, and especially when we try to see the case in Senegal. Generally, we found that 43% of interviewers feel that the COVID has had negative impact on their activities. And those results has already been presented in a number of conferences and also in publication, especially a paper we have on mitigating impact of the COVID-19 on domestic rice value chain and food security in West Africa, where we can see a number of measures that we propose. And finally, we have also already a data set which help to provide advice on how to increase the resilience. Thank you.
Thank you very much, Dr. Aminu, again for that quick one. Next, let's move on to the next segment, which is a quick Q&A session. For our audience, please continue engaging with us via the chat box, and we'll read some of your responses. To the first question, and can I have all my speakers together? We have the question: what is Africa's biggest challenge in One Health? Please let me see your responses. I can see Dr. Stahl, frequent local interaction between people and livestock and wild animals. Okay, good. Dr. Najjar, do you want to voice yours?
Yeah, sorry for that. Mine is balancing human, environmental, and animal health.
Okay, thank you very much for that. I saw Amino's. Amino says food and nutrition security. The
Insecurity.
audience, yes, the audience, I'm going to read yours shortly. Let's move on to the second one, kindly.
What's the second question?
Let's see the presentation. Anyway, I have it. The second question reads, just a minute, sorry for that. What is One Health action? What is One Health action to help African food systems recover from the current pandemic? Amino, you want to read as yours? I can't see it well. Okay, capacity building. Steven says increased vaccination, and Dina has put hers in the chat box, which is regulating access to consistent and affordable supplies. Okay, in the interest of time, I will need to move on to the third one. And for my audience, I see your comments. I will read one as we finish. The third question is, what is One Health action to help African food systems become more resilient? You can see them. Okay. I hope my audience can see them. Seems clear. Innovations based on local knowledge from Amino, and Steve says increased awareness of zoonotic risks. Dr. Najjar, you want to voice yours?
Improving market access while complying with public health measures.
Okay, great. Thank you so much for that. Question four, again, quick fire. What do we need to do to better implement a One Health approach? What do we need to do to better implement a One Health approach? You can see that. Increase awareness of zoonotic risks, integrated research. Dr. Najjar? All right.
Collect sex disaggregated data to respond with proper policies.
Okay, great. Fifth question, can One Health prevent another pandemic? You can see that. Dina agrees. Steve says unlikely, we can only mitigate. And Dr. Amino, maybe you voice it. I can't read it well. Okay, yes, it's a yes. It's okay. And finally, the sixth question that we have is, if you had 10 million, where would you invest in One Health in Africa? And for this one, I want my speakers to speak their responses as you raise it up. So, Dr. Stahl.
Yeah, a study found that there was very, very poor understanding of zoonotic risks in a lot of rural communities. So I think it's very important to invest in better understanding of zoonotic risks.
Dr. Amino?
For me, I think I think that we need really to invest in all measures that help to increase food and nutrition security.
And Dr. Najjar, thank you for that.
Yeah, so following Stephen, I would like to say that our findings confirm that perceptions and experiences of disruptions and the coping strategies are different along gender lines. So I would collect sex disaggregated data to respond with proper policies when this data is not available.
Great, thank you very much. And as I had warned earlier, it has been a very rapid session, but we've managed to get through. I want to close by thanking all my speakers plus the audience. Please, for the audience, I'm sorry I didn't quite get to you, but let me mention that there is actually a birthday message for Dr. Najjar. It's your birthday, and Ziad is saying happy birthday. No better way to have it here on a panel. So happy birthday to you. And for the rest of my speakers, thank you very much. It was quick, but I hope that we have gotten an insight into what's going on regarding CG's work on One Health. So let's continue this conversation on social media. Let's go to using the hashtag AGRF One Health, and let's look at the Twitter handles of IFPRI, ILRI, and also at the CGIAR for the conversation. Thank you very much.
Thank you, Vivian.
Thank you. Bye-bye.
Bye.
Bye.